cocaine addicts. I'll tell you why. Let's go back here. I've been working in emergency rooms dealing with people abusing cocaine for, since the mid-'80s. What happens when you use cocaine? Well, the big one, let's say it's your heart. So you do cocaine, your heart speeds up, your blood pressure increases, your vessels constrict, your heart beats faster. So now you have less oxygen going to the heart. Your heart's beating faster and it's beating against more pressure because now your blood pressure's up. Your vessels constrict. So what happens? You could get a heart attack. You could get a stroke. Also, the cocaine causes an effect on platelets, which causes clotting. You could throw a clot, pulmonary embolus, throw a clot in your brain, a stroke. I've seen that a lot. It does something else. Also, it interferes with the electrical signals in your heart, so your heart starts to flutter. But it's not the atrium, the little part of your heart, it's the ventricle. Ventricular arrhythmias, well, what does that do? That leads to strokes. That can also lead to heart attacks. It does more. Long term, it causes damage to the vessels that can cause aneurysms. The vessels are like this, causes them to open up in a narrow area and pop. So it can cause aortic dissection, where your aorta is like this and then it just rips. It can cause decreased blood flow to your intestines and get intestinal tears, dead tissue in the intestines. That's not good. It gets worse. Long-term effects on the vessels cause them to stay constricted long-term. That means they tighten up like this. So less blood flow to your organs, your muscles, your body, less blood flow. That means removing less pollutants and bringing in less oxygenated blood. Things die. Organs fail and you die long-term. And also what it does, the heart gets really thick from beating against high blood pressure all the time. It gets really thick. And it causes congestive heart failure. As it gets too thick, it can't expand like this. When it gets too thick, it just doesn't do anything. It's just one thick wall. It needs to be like a balloon where it can open and close. It gets too thick, well, there's not enough contractility to make it work as a good pump. So if you're an old cocaine addict, you could have congestive heart failure. Your vasculature is shut down, so the blood's not moving to your organs, to your limbs, and you get cell death and organ death, and you die. These are permanent effects. So you could get these long-term congestive heart failure, peripheral vascular disease, organ disease from cocaine use. So you may stop, but 30 years later, you're paying the piper. So you're screwed. So it's not good. And short-term, I've seen it cause like the endocarditis, myocarditis, the heart muscle or the pericardium gets inflamed from cocaine. So this is why there's no old cocaine addicts, because even if they did survive their cocaine years, the permanent effects from the cocaine on their vasculature, on their heart, winds up killing them. This is just basically what drops a lot of them, not to mention social and impulsive risk-taking behaviors and all the other factors that go along with cocaine addiction. But I just wanted to, I was talking to my patient yesterday and I said, if you really think about it, there are no old cocaine addicts. Why is that? Well, there's your answer. I just gave it to you. That's why there's no older cocaine addicts, because most of them die of heart, strokes, arrhythmias, and to boot, it's much worse in people who drink and smoke cigarettes and do cocaine. They have even a higher incidence of the stroke, the heart, the ventricular fibrillations, ventricular arrhythmias, the collapse of the vasculature, the hypertension, aortic dissection, intestinal tears because of lack of blood flow to the kidneys, kidney disease. So you get it. And most people who have cocaine habits, I could tell you, I would say half of them smoke and more than half drink. So that is the extra risk. Because you're smoking, that increases coronary artery disease, as does the cocaine. It speeds up your heart, constricts coronary arteries, stops the regeneration of the vessels. It's called the endothelium cells. Those are the ones that make up the little vessels in your body, the cells. So that's the happy news there. I hope you all enjoyed that video. Don't use cocaine is the moral of the story. You can get more fun facts in my book, Tales from the Couch on Amazon.com. Subscribe, like, leave comments. Thank you.